Good afternoon. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer for the province of Manitoba. Today we are announcing 3 additional deaths due to COVID-19, 1 from the Interlake Eastern region, 1 from the Northern Health region, and 1 from the Winnipeg Health region. I want to extend my condolences to all the families, friends, and caregivers of the individuals announced today. The current 5-day COVID-19 test positivity rate is 4.4% provincially and 3.6% in Winnipeg. As of 9:30 a.m. today, 116 new cases of the virus have been identified in Manitoba. The total number of lab-confirmed cases in Manitoba is 33,810. Additionally, public health officials are announcing that 46 confirmed cases of the B117 COVID-19 variant of concern has been detected in Manitoba. The 44 variant of concern cases are from the Winnipeg Health region and 2 are from the Southern Health Santé Sud Health region. A reminder that the vaccine eligibility age for the general public is people over the age of 65 or over the age of 45 if you're First Nations. I encourage you to call or go online to make an appointment today if you or a loved one is eligible. To those who speak Punjabi, Je twadi bari agi vaccine lan le appointment banao coronavirus vaccine tika lalo. New orders in effect today. On Tuesday, we announced the next steps in a slow, cautious reopening plan, which included remaining at the critical or red level on the #Restart Manitoba pandemic response system. A reminder that the following changes went into effect today. Outdoor gathering limits in public places are increased to 25 people. Limits for weddings and funerals increased to 25 people. Retail stores maintain the 50% capacity limit with expanded in-store limits to 500-person capacity, whichever is lower, with other public health measures still in effect. And rules have been relaxed for drive-in events to allow people to leave their vehicles while still observing public health measures. All other health measures remain in effect. These orders will expire on April 15th. You may have heard that there were some delays at the RBC Convention Centre Supersite today. This is due to a combination of having a large number of appointments today and an issue related to our staff scheduling software. The staffing system issue led to a shortage of staff at the site today. As soon as the issue was identified, the team began reaching out to bring additional staff on site to make the process go more smoothly and to reduce waits. The work is underway, with more staff expected to arrive in the next couple of hours. We know that some patients are waiting beyond their time of their appointment, and we apologize for that. Coupled with that, please don't come too early for your appointment. Make sure you come during your designated time. We greatly appreciate your patience. Know that work is underway to address this issue for today and the next several days as well. The team will be reviewing staffing needs going forward, so this doesn't happen in the future. Spring break, Easter, and Passover. Spring break is next week, as is Easter and Passover. I'd like to remind Manitobans that public health continues to advise against non-essential travel. Do not travel unless essential. Help us keep case numbers low during spring break to protect your fellow Manitobans. Similarly, while we know Easter and Passover are usually celebrated by gathering, we need to do things a little differently this year once again. The current orders allow for 1 other designated household or 2 designated people for the holidays. Private outdoor gatherings can have up to 10 additional people to those from the house that they are residing from. Restaurants allow for households to eat together inside, while the patio can accommodate up to 6 people from different households. Even though the orders do allow for small gatherings, please do so with caution. Stay as physically distanced as possible, wear masks in close contact spaces, wash your hands frequently, and don't attend the gathering if you're not feeling well. I know this is not how we want to celebrate the holidays, but we need to keep being cautious and guard against COVID-19 and the variants while we're waiting for more of our population to be immunized. We want to continue opening up, and the only way we can keep doing though is if we continue to follow public health orders and messaging. This is not forever, but it's what we need to do right now. Giving blood. While I encourage Manitobans to stay home as much as possible, donating blood is still very essential, and donations, especially around spring break and Easter and Passover, are important. Please consider booking an appointment through Canadian Blood Services to donate blood to help save a life. I can now take questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Free Press, Danielle.
Hi, Dr. Atwal. On the variants of concern, what can you tell us about the impact that public health is seeing so far? What settings are the cases being detected in as far as outbreaks and clusters? Are they workplaces or schools? And I'm interested to know what the secondary attack rate is, how much greater, how many more cases you are seeing from each infection, and how is contact tracing keeping up?
That's a great question. We're still compiling a lot of the data, as our numbers increase. So I believe right now we've got 109 cases of the B117 variant. We have 14 cases of the B1351 variant. We are seeing higher numbers of the B117 variant. We have seen some unknown acquisition of that. We have seen small clusters related to, a school or two. We have seen some occupations impacted by it as well, so occupational exposures. We're still compiling data to look at secondary attack rates. It's a little too early to determine those numbers as well. So as the days go on, as we compile that data and analyze that data, we'll have some better information for you as well. So, in general, we are seeing an increase in our cases throughout Manitoba. So if you look at our 7-day average, we're starting to see that increase, that rise, which isn't unexpected. We knew that would occur with the greater number of interactions people are having. But we do see, coupled with that, the number of VOCs increase as well. So roughly 32% of all cases in Manitoba right now are testing positive for a VOC. So we're keeping a sharp eye on it to get some of the specific numbers that you're asking for. It's going to take us a number of more days to compile that data to get some better numbers in relation to secondary attack rates.
Okay, thank you. Looking forward to that. And can you tell us how many cases have been screened in as presumptive or probable variants of concern? What can Manitobans expect as far as future numbers of cases related to variants of concern?
So, as anticipated, once a variant of concern sort of takes hold, we've seen this in other jurisdictions, the proportion of a variant of concerns will increase. So, that's what we're seeing right now. So I'd mentioned, 32% of all positives are the variants of concern in Manitoba right now. The absolute numbers we gave you already, with 44 new today being variant of concern, those are sequence positives. So I think next week we'll likely see some higher numbers related to that as well on a proportionate basis and an absolute basis. So again, we're going to continue to monitor that. We are, again, expecting a slight increase in cases as well, and that's why we're asking Manitobans to keep adhering to the public health orders, the measures, and to also, prioritize. Yes, you can do a number of different things. You can, go to a restaurant, you can go to a museum, let's say, you can go to a church service, you can get together with individuals at your home or in a public place, but every interaction, does cause a little bit of risk. So as a bit of an experiment at home, whoever's listening, think about all those interactions you had on a daily basis for the previous 2 weeks. Each one of those interactions, if you write them down, poses some inherent risk. Some are a little bit less risky and some are a little bit more. So we continue to need to be aware of that. We need to be aware of how cases are generated. So again, any interaction, and we want to try to limit those interactions as well to allow us to continue to maintain our course in relation to Manitoba and case numbers in Manitoba.
From Global News, Marnie.
Good afternoon. New data out of Ontario is showing that the death rate for variants of concern is significantly higher by about 60%. Just as we're slowly moving to start loosening restrictions, what's your reaction to that?
Yeah, so I know there was some media out in relation to what Dr. Theresa Tam had mentioned. There were some references to Ontario-specific data, also referencing what's happened in the UK and some Danish data as well. So we know the variant. We know the UK variant, the B117 variant, is 50% more communicable, maybe a little bit higher depending on the study that you read. There's some literature out there. There's an association with higher risks of hospitalization. So a 60% higher risk of hospitalization with the B117 variant. 100% higher risk of ending up in an ICU compared to the, the normal or the initial strain of COVID-19 in Manitoba, and also a 60% higher risk of death. So, there's ongoing studies on that to really determine, are those the accurate numbers? So there's going to be more and more studies done on that. We're looking at the literature every day as well to ascertain that risk. And that's why we're still messaging to Manitobans. We have had a gradual opening. We haven't really opened everything right up. There's capacity limits. There's restrictions on those interactions with people. We've asked businesses to do certain things well. And that's because we want to keep our case numbers low. Like, we understand the higher risk of communicability. We do understand that there will be a higher burden on our healthcare system if we start to generate a lot more cases. But it is up to Manitobans. Manitobans still need to adhere to, hand washing, staying at home when you're sick, adhering to the orders, coughing in your sleep. So it's going to be up to all of us to keep these numbers down, and that's why we continue to stress those points to all Manitobans.
Thank you for that. With the delayed shipments of Moderna, is that going to be impacting operations at Supersites or pop-up sites next week?
Yeah, I don't, we were looking into that this morning. I don't have an answer to that. And I think, once we have some more information related to that, the vaccine task force could provide the best answer to that.
From the Brandon Sun, Colin.
Afternoon, Dr. Atwal. We've had a couple of readers inquire, are they allowed to hold yard sales or garage sales under current public health orders?
Yeah, so, we would treat that as sort of a gathering on your premises, right? You're allowed to have 10 people outdoors on your premises. So I think you're allowed to have a sale. I think you'd have to make sure measures are in place to make sure people are allowed to distance. I wouldn't have more than 10 people in your driveway or your yard for a garage sale as well. There's a lot of high touch surface areas. A lot of people like touching things, so make sure that there's, disinfectant around and adhere to those public health measures as well. I would promote mask wearing in that situation as well.
Has the province yet seen any instances of someone who's been vaccinated getting a variant of concern and having it improve their outcomes at this point?
Yeah, so we had a number of individuals vaccinated. We've had some of those individuals develop an infection after the vaccine. You have to remember, it takes 2 weeks for a vaccine to fully work after that first dose to get the full effect from the first dose, and even then, you still want to get that second dose to get that maximal effect. So with 2 doses, vaccines are 95% effective after 14 days of receiving the second dose. With 1 dose after 14 days, you're probably looking at 70 to 85%, depending on the vaccine, how effective it is. So we have seen some of those cases. We're analyzing those cases to look at what that risk is on a percentage basis. And, the numbers are really small right now for that. So we're going to continue to analyze it. And as we get more information, we'll analyze it in more detail and compare our numbers to those from around the world. So around the world, we know a lot of countries, they have access to a lot more vaccine than what we've had in Canada. They were able to vaccinate a lot of individuals, even with 1 dose. And even with the 1 dose, they still generated cases, but their risk of hospitalizations was much less in those countries or in those jurisdictions. So, we continue to look at the literature from around the world as well in relation to this.
From CJOB, Clay. From CJOB, Clay.
Yes, hi. Sorry about that. Dr. Atwal, good afternoon. Have we been able to determine if any of the variants are turning up in young Manitobans? I'm talking about students, high school students.
So we have had some variants of concern in younger Manitobans. I don't have an absolute number for you right now, but we have seen that happen.
Do you agree with Dr. Theresa Tam, who says that we are in a bit of a race right now between getting vaccinated? She calls it team vaccine versus team variant, because the variants are on the rise? The number of cases are on the rise?
Yeah, so, Dr. Tam's looking at national data, aggregated data right across the country. Manitoba specifically, again, we're a bit of a unique situation in relation to the variants. We have smaller numbers, even on a percentage basis, compared to some of the other provinces, which again puts in a good spot right now. But obviously things are changing. Things have changed in the past couple of weeks as well, and the number of variant cases that, have been created in Manitoba, and we're going to continue to see that rise. I think that's expected. And we are in a bit of a race here. The more people that we're able to inoculate, it should lessen the impact of a variant taking hold and causing cases, or even the normal strain of COVID-19, which in turn prevents, hospitalizations, which prevents ICU use, and which prevents deaths as well. So it is a race. It's not a 100-meter race. We have a long way to go with COVID-19. We have a long way to go with the variant of concern, such as B117 for right now, and we have a vaccination plan that is over the next 3 months' time for sure, and it's going to be ongoing there afterwards. But everything's put together. So it is a bit of a race, but it's more of a marathon, I would say, rather than a sprint. And that's why we need to continue to be cognizant of our interactions to limit the risk of having COVID-19 and spreading it as well.
From the Winnipeg Sun, Glenn.
Glenn Dawkins from the Winnipeg Sun. Good morning, Dr. Atwal. The variant of concerns that that you're reporting on today, the numbers seem I don't want to say concerning. Numbers seem worrisome. Can you put those numbers into some kind of perspective in terms? And I'm assuming that these aren't from these current new cases, but as in cases that you're ready to identify now and announce on time.
Right. So the 44 new cases of the B117 variant that were announced today, those are sequence positives, right? So, those would have been positives or announced positives from a few days ago till now. And obviously, this number is going to be repeating itself on a regular basis. Not that same number, but that's sort of the time lag from a sequence, from a test positive to a sequence to us reporting a sequence positive. That is a variant of concern. I think next week we're going to look at reporting things a little bit differently that might provide a little bit more clarity, a little bit more real-time numbers in relation to variants of concern as well. So the numbers will look a little bit different next week. Worrisome is a strong word. I think we're well aware, again, of what was going to happen, and we see it happening. We know at some point the variant of concern will become the dominant strain. And we probably won't be calling it the variant of concern at that point. We'll be calling it, COVID-19 again, until potentially another variant of concern happens to arise in Manitoba, which may never happen, or which may happen, 3 or 6 months down the road. So we do have to be aware of that. From a public health perspective, again, we're managing cases much more aggressively as well in relation to a variant of concern. And those measures are at some point just going to take over for all COVID-19 cases that become positive in Manitoba. So we do, from a public health perspective, we're putting a great amount of effort into reducing that risk of absolute case numbers increasing. We're going to continue to do that. And that's why we continue to ask Manitobans to continue to limit those interactions. Stay at home when you're sick, go get tested, cough into your sleeve, and really adhere to the public health orders.
In the vaccine update that was released earlier this morning, talks about the focus now, or the focus being more on the first doses of the vaccine, I guess, as opposed to both doses. Can you comment on that? I'll call it a strategy, but that, strategy for a better word.
Well, initially we had a 2-dose regime in place. That's what the science had said. And as the science changed, our advice changed as well. So we've been in a 1-dose strategy for a period of time. So we are still providing that information to the public. 106,000 different Manitobans have been vaccinated with at least 1 dose of a vaccine as well. So, roughly, I think it was 9.9% of the population who's eligible has had a vaccine as well. So as vaccines coming in, in, we're distributing it out. We're going to continue to do that. The emphasis on the one dose, I think that is the plan for right now. We are looking at a one-dose regime for all Manitobans with a 12-week period, a 16-week period before that second dose is provided as well. So we're going to continue to, present numbers in that fashion. And again, the greater number of Manitobans that do get the vaccine, the greater protection there is for all of Manitoba, the greater opportunity there is for Manitobans to start doing more of what they want to do and what they love to do. So we really need to be aware of that. We really need leaders to step up and talk about vaccine, to limit vaccine hesitancy. We need that support from the public as well in relation to getting those who are eligible to a vaccine site to get that vaccine.
From CBC Radio Canada, Zoe.
Hello, good afternoon. Dr. Brent Roussan said this week he was aware of the variants of concerns affecting younger people. Now, did you see some specifics in Manitoba related to young adults more affected by the third wave?
Yeah, we haven't, I haven't seen that data yet for Manitoba. I mean, obviously we've had infections in younger individuals. There is data coming out of Ontario and other jurisdictions indicating that younger people, compared to the original strain of COVID-19, have a higher risk of hospitalization or an ICU use with the UK variant, with the B117 variant. And that same held true in the United Kingdom and in some other studies internationally as well. So we are aware of that. We are keeping an eye out for that. At this point, we don't have any specific data for Manitoba related to that. Again, our case numbers are low. We're still monitoring that. But that is something we are cognizant of and will be keeping track of.
Thank you for that. And if we have more variants of concerns coming, are the restrictions in place sufficient?
Yeah, from a public health perspective, we feel the restrictions in place are good restrictions to have in place. Again, we have opened things up. We are allowing some of those interactions. There are some priority things Manitobans have desired that, some are in general low risk. I think from a capacity perspective, from absolute number perspective that we've used within the orders, we're mitigating a lot of risk as well. So at the present time, again, we understand the case numbers will have gone up. We anticipate they're going to continue to go up, and we're going to keep a close eye on those case numbers. And coupled with that, we're going to look at other indicators as well, like we always have, hospitalizations and ICU use. So again, the longer we could prevent that significant rise in cases, the greater number of Manitobans that are immunized really has an impact on hospitalizations and ICU use. So we all should be aware of that. And again, if you're eligible for that vaccine, go out and get that vaccine.
From CBC Manitoba, Austin.
Hi, Dr. Atwal. We're hearing that BC is preparing to allow in-person visits at personal care homes where staff and residents have been vaccinated. I'm wondering if Manitoba will follow suit, and if so, what that might look like.
Yeah, we're looking at that scenario right now in Manitoba. We're just finalizing what that would look like and how it would operationalize. So when that information is available, we will provide that to everyone.
My follow-up question would be, according to the latest federal national vaccine map, it puts Manitoba third last for the number of people getting vaccinated. Can you tell us why we're falling so behind other jurisdictions?
I haven't looked at those metrics. I think vaccines coming in relatively smoothly into Manitoba. There's been some ups and downs. Again, we want to get more and more doses in Manitoba from the federal government, and they have to get it from an international market. So there is that rate limiting step there. I think when you look at the geography of Manitoba and how Manitobans are dispersed across a large area, we have fly-in communities, we have rural and remote areas that are 3 hours away, let's say, from the closest medical clinic. We also have urban centers as well. So, as vaccines coming in, we want to make sure we're providing that vaccine to those most at risk, and we've targeted that. And we have a higher percentage of our population that would be considered higher at risk compared to other provinces. So that plays a role in sort of the vaccine rollout and distribution. Not that we're lagging behind, but we have to logistically bring it into a community, let's say fly it in and organize a large clinic with a number of people from that community as well. So there's a couple of extra steps related to that as well. as well. So I'm proud of our vaccine program. I think they've done an exemplary job. I think they're going to continue to do so. And again, as more vaccine comes in, we're ramping up to be able to provide more of that vaccine as well. But I think geography plays a role. I think our population, which is a little bit unique compared to other provinces, plays a role in this as well.
From the Canadian Press, Steve.
Oh, hi, Dr. Atwal. You had mentioned the literature points to a higher risk so far of hospitalization and ICU usage from these variants, and we're seeing the number of variants rise. So what's the situation in Manitoba's ICUs right now? Are we, after that sharp drop we've seen in recent months, are we getting close to above capacity again?
Yeah, so I know right now we have 58 people in the hospital with an active COVID-19 infection. There's 84 who are covered for 142 in total. We have 12 active COVID-19 infections in the ICU with another 19 who've recovered for a total 31. So I think we've seen a little bit more cases in hospital related to COVID-19 right now. So there is that impact there. I mean, I believe our acute care system, we never had 0 cases of COVID-19 in hospitals or ICUs at all. Even with that drastic decline that we had, we sort of plateaued down to some of these numbers that we're at right now. So again, we're going to keep a close eye on this. We have to remember, you know, from a test positive date to when someone actually presents into a hospital situation, an ICU situation, there's usually a lag time. You know, you're actually diagnosed first with COVID-19 because you develop some symptoms, you go for some testing. Thereafterwards, you know, people are at home, they start to deteriorate clinically. You know, they get more short of breath, their work of breathing increases, they fall into some respiratory issues, and then they present to the hospital. So the case generated today, we might not see in hospital for 7 to 10 days. So we have to be aware of that lag time as well. So again, you know, as time goes on, we'll have to look at that trend and see if we are seeing a higher risk of hospitalization in Manitoba related to the cases that are being generated that are specifically, let's say, the B117 variant going forward as well.
And given that lag time, and given the sharp rise reported today in the number of B117 cases, is the province looking at pulling back some of the reopenings or enacting tougher public health orders?
Yeah, I mean, these orders are in place for, you know, till April 15th. I think from a public health perspective, we're comfortable with these orders. We meet with acute care, our colleagues, every day. I know we have discussions with them about the cases in hospital, what they're seeing as well. And at the present time, I think we're very comfortable with the orders, the way they look, how we've opened up. And we're going to reassess the situation every day. And every week we'll be taking a look at those numbers to decide our next steps, you know, whether, and I can't speculate for the future, you know, we'll have to look at all those numbers in next week and the week after to decide, do we open up a little bit more? Do we keep everything the same, or do we have to pull back a little bit? Our desires aren't to pull back. We mentioned that from the beginning. We've always wanted a gradual, slow opening, and that's what we've done. So we'll have to see where those numbers take us in the next week or two.
From CTV Winnipeg, Stephanie.
Hi, Dr. Atwal. You kind of touched on this already, but Dr. Tam was saying today, kind of urging provinces to look at more precautions and potentially more closures. Could we be seeing that, though, just given the amount of variant cases today? You mentioned we'll likely see this continuing to rise, and with our gatherings now up to 25 people. Are there concerns we could see it pulled back?
Yeah, again, you know, I think we'll have to look at the data. It's really hard to have that crystal ball to look ahead. Again, we feel comfortable with the orders, with the way they are. You know, Dr. Tam is looking at national data. So she's looking at what's happening in BC, Alberta, Saskatchewan, Ontario, Quebec, you know, the Maritimes and the territories, and putting it all together. Our numbers, you know, is in general on a population, on a rate basis, is less than a lot of those provinces. Not all, but even to our neighbors to the west, we're less. To the east, we're less as well. So we are unique in that fashion. So I think we'll have to just continue to look at our numbers, our hospitalizations and ICUs, and take those those next steps if needed. And again, it is hard to speculate out into the future. Some provinces have greater restrictions than us, but I think most of them actually have less restrictions than us as well. So again, we're looking at that slow opening that we talked about. We did go slow, and we're going to keep looking at that slow opening, and we're going to have to look at those case numbers and hospitalizations and ICUs day by day and week by week and make those decisions closer to the time when these orders expire.
And there's data showing 55% of Manitobans over the age of 80 have been vaccinated. What are the barriers kind of stopping these folks in this age group from getting an appointment, and is the province making plans to make it easier for people 80 and above to get an appointment closer to home?
Yeah, so those numbers change every day. You know, when you're looking at percentage of individuals over the 80 who've gotten a vaccine, you know, you have X percent. There's people today who are over 80 getting vaccine. There's going to be people tomorrow and the day after. So that number is in flux all the time. And it's just the nature of, you know, when that person was able to get an appointment or be able to get a ride to get to the appointment as well. So we have to keep that in mind. You know, when you're looking at absolute numbers at one point in time, there still could have been a number of people there afterwards who had a booking for a vaccine, but just haven't been able to come in yet because their booking was 2 days later, 3 days later, or a week later. So again, those numbers will change. Manitoba is a large province. You know, geographically, there's isolated populations. We've got sites open right across the province. We're targeting specific areas as well, and we're going to continue to try to expand our ability to get to all Manitobans to get that vaccine. So someone who's a little bit older, it might be harder for them to, let's say, travel for whatever means for, let's say, 45 minutes or an hour to get a vaccine. And when something comes closer, they might be more conducive to get that vaccine as well. So, you know, we're going to continue to explore those opportunities. From our distributed model, you know, we had the AstraZeneca vaccine, and all those have been accounted for, where we distributed them all out to pharmacists and to, you know, practitioners throughout the province. And there was a tremendous amount of uptake on those. You know, that was specific to, let's say, 50 and 64. As more vaccine becomes available, as we can get more vaccine closer to individuals in their home environment, we're going to see greater uptake. You know, the numbers look good. They aren't bad. It's not unexpected, but obviously we want to see the numbers higher, but we're still early on when we've opened this up to the public. So I think we have to give it some more time to look at that vaccine uptake. We're also looking at a lot of messaging, or we have a lot of ethnic groups in Manitoba as well, so we are focused on those groups to make sure that they are able to understand the messaging in relation to vaccines as well. So we're going to continue to look at those avenues and support Manitobans wherever they are to get the vaccine information they need and to be able to access getting a vaccine.
From City News, Jonas.
Good afternoon, Dr. Atwal. I just want to touch base on what seemed like some concerns over vaccine hesitancy from you and mentioning community leaders need to step up. Just wondering who you would be referencing and who you would like to see maybe getting vaccinated in public or maybe raising the profile of it.
Yeah, I think anyone who's eligible. You know, there's leaders all around. You have leaders. Every person in Manitoba probably looks up to somebody. Right? I look up to different people. When we look up to people and they show that, you know, this is safe, this is recommended, this is what they should do, and they're eligible, I think anyone in that position should step up and show whoever, you know, follows them to get that vaccine. You know, it could be physicians. I'm a physician. It could be physicians. It could be nursing leaders. It could be politicians. It could be church leaders. Anything. You know, I think the more that we make vaccine talk safe, talk about the safety of it, talk about the availability of it, and talk about the acceptance of it to get that normalcy back in Manitoba, we should take that opportunity.
Thank you for that, sir. I guess just from a public health perspective, is there a need to maybe get more of an ad campaign or more information to battle some of the vaccine, I don't want to say misinformation, but maybe some of the debate online that folks may find themselves in?
I mean, I encourage Manitobans, you know, you shouldn't get a lot of your information off of social media that isn't government run or led by leaders, let's say, in medicine. You know, we've had issues with that all through the pandemic. And even before the pandemic, there's a lot of misinformation out there, and there's a lot of misinformation out there from a vaccine standpoint, even before the pandemic. Go to trusted websites. The government has some great websites. Public health has some great websites. Nationally, there's some great websites. Internationally as well. So seek that information out. The College of Physicians and Surgeons has some good websites. Doctors Manitoba. There's a lot of good information out there that is based on science, that is reputable. That's the type of information people should be seeking. Getting a tweet from a friend or something like that, probably isn't the best way to inform oneself on safety and on availability of a vaccine. So I really encourage Manitobans to seek out that information. Go talk to your healthcare provider. Call your pharmacist, call your doctor, and get that information from them. That is the most trusted information you will get. So I really encourage people to do that.
Our final reporter this afternoon from APTN, Daryl.
Good afternoon, Dr. Atwal, Daryl Stranger, APTN News. I just had a question about vaccinations. If your First Nations or Métis in Northern Ontario and you're 18 or older, you can get a vaccine right now. And moving into next week and into April, Ontario, BC, Alberta, Métis citizens can get a vaccine as well. So I was just wondering why Manitoba has not prioritized Métis citizens like they have First Nations for vaccines like these other jurisdictions.
I mean, we've opened up vaccine for Manitobans. We have that 20-year age difference for First Nations individuals. Anything much more specific on the vaccine side related to ages, et cetera, I think the vaccine task force would be best answering that question.
Okay, and just following that, would you be able to say if there's any plans to include Métis and Inuit here in Manitoba for a priority list maybe in the future?
Yeah, I mean, I believe groups like that are included to some degree right now. So again, I think, asking that question to the vaccine task force would be best.
Thanks, everyone.